In this video, we're going to demonstrate how to set up non-evasive positive pressure ventilation with BIPAP with LTV1200. If you've checked out the other videos on the Revell, you know that the startup menu is where we access the NPPV mode, and in the LTV1200, accessing BIPAP or CPAP is actually done with the ventilator turned on, and you can see our NPPV button, or light I should say, right here. So we're going to access this by hitting our select button once. You can see it blink. Hit it again, and you can see that all the lights except for your IPAP are now lit up. So the IPAP is lit up, all these lights are dim. And so let's say we want an IPAP of 12. We have to remember that the LTV1200 is additive, so it's whatever is over PEEP. So if we wanted it 12 over 5, that means we need to basically subtract our PEEP or our EPAP from our total pressure. So if our EPAP is going to be 5 and our total pressure is going to be 12, we subtract 5 from 12, and this is what we put in this spot. And so we have 7 over 5. And so 5 plus 7 is 12. That's your total pressure. Now you can see that our NPPV is actually lit up. And you can see that our apnea backup is going to be based on whatever rate we have set here. So we can turn this down to 12. The other difference between the LTV1200 and the Revell is you don't have that augmentation rate that we can set to assist the patient even if they're breathing adequately. And the LTV1200 is limited in that way. We do have to do the same things though. We have to go into the back menu. Remember, we want to hold our select button down, and we want to go to our vent op. We can select our flow termination. We want to set flow termination at 35%. We want to make sure it's there. And then we want to turn our time termination to match our I time. So our time termination needs to match our I time. Your I time should be set between 0.8 and 1 second. And so once we're good there, we can go back to our standard mode and continue. I'm going to switch this back just so it doesn't alarm. So again, remember that this ventilator is additive. It's whatever is over PEEP. If we wanted to start out with an IPAP of 12 and an EPAP of 5, we just take our PEEP, our EPAP, subtract that from our IPAP number, and that's what we're going to put in this pressure support area. So now we have 5 plus 7 is 12. That gives us our high pressure of 12 and our EPAP of 5. Again, if you have any questions regarding any ventilation aspects of the LTV1200, the Revell ventilator, or anything related to the transport environment, please email me at eric.bauer@flightbridgeed.com, and I'll talk to you soon.